Hello, hi. Good morning. I'm Dr. Shanmuga Sankar Ram. I'm a general cum laparoscopic surgeon of our Devadoss multi-specialty hospital. Today, we're going to discuss about the tumors of the breast. Breast is otherwise called as the mammary gland or the mammary organ. We always consider breast to be a precious organ or a gland because breast gives the first feed to the new life that jump into the earth. So what are the tumors of breast? That include fibroadenosis, fibroadenoma, breast abscess, phyllodes tumor, and cancer or carcinoma of the breast. These are the common tumors that affect the breast. There are a lot more, but these are the commonest one. So we're going to see the signs and symptoms of each tumor. Number one, fibroadenosis. It is a non-cancerous or a benign tumor. It usually affects young girls from age of 14 after they attain their puberty to ladies up to 35 years. This fibroadenosis can occur as a single lump. Usually it do not occur as a single lump. It occurs as a multiple lump. First of all, we should know what are all the quadrants of breast. The breast is divided into 5 quadrants: upper outer, upper inner, lower outer, lower inner, and a quadrant which is below the areolar and nipple. So this fibroadenosis can occur on any quadrant. It can, as I told you, it can occur as multiple lumps. It can occur in form of clusters, that is more than 2-3 lumps put together, or it can occur as individual multiple lumps involving almost all the quadrants. And sometimes the patient experiences a discharge, serous discharge from the nipple, and the patient often have pain, and the pain aggravates during menstruation as well as during pregnancy. Next is fibroadenoma. Again, fibroadenoma, it is a benign tumor. It is a non-cancerous condition. This fibroadenoma usually occurs as a solitary tumor, like a marble which is rolling or just beneath the skin. It can again occur on any quadrant. Usually it occurs on the lower quadrants, either inner or outer of the lower quadrants. And it is freely mobile, and that's why it is called as a breast mouse. When you try to catch it or press it, it slips out and go to the other quadrant. Number 3, breast abscess. This usually occurs in lactating women when the women feed. Now the recent advances says 5 to 11% of the lactating women tend to develop this breast abscess. This occurs due to blockade in the lactating duct. It can be either by infection or due to some foreign particles. Next is the breast carcinoma. The breast carcinoma is a very dangerous condition. Initially, it usually occurs of ladies more than 30 years. So when a lady is having a lump, again when it is painless, they should be very cautious because it might be a carcinoma, cancer. Usually a carcinoma lump usually occurs in the outer quadrant, usually in the upper and outer quadrant of the breast, and there might be a blood discharge from the nipple. Next is phyllodes tumor. Phyllodes tumor, it is otherwise called as a giant fibroadenoma. Usually it appears solitary and the size may range from 3 to 5 centimeters. Sometimes a huge phylloid tumor can even go more than 10 centimeters, involving almost all the quadrant of the breast. Again, the patient often experiences pain and the patient will be having dilated veins over the affected breast. The patient themselves can diagnose. They should be aware of self-examination of the breast. So each female should know how to self-examine their own breast. And whenever you find a lump in the breast, then you visit a doctor or a consultant or a surgeon. And we got few techniques, like we can always do a ultrasound of the breast, which will tell you what type of nodule it is, whether it is cystic or a solid nodule, or the exact location of the nodule. The other test to confirm it exactly what type of a tumor, we do a test called as FNAC, fine needle aspiration in cytology. It's again a small procedure. And the treatment of breast tumors, if it is a benign tumor, the treatment is just excision of the tumor and we send it for biopsy. Fibroadenosis do not require even surgery. It is treated medically, conservatively. Whereas a cancer or a carcinoma, it is nothing but the removal of the entire affected breast. It is called as MRM, modified radical mastectomy. We remove the entire breast. Not only that, we clear the entire lymph nodes in the axilla on the affected side and we send it for biopsy. Followed this the patient needs chemotherapy. So as I told you, since we preserve or we expect this to be a good organ which feeds the new life, please do not leave it loose. Go visit a consultant as soon as possible and keep it free of diseases. Thank you.